Hi everybody, Dr. Todd here. In this video, we're going to talk about how does traction work. So the whole point of traction, we have different traction equipment that is set up to address different types of spines, different types of patients, different postural problems. But the whole idea, the whole premise behind this is that one, there is an ideal position of the spine, or at least a reference point or a range of normal of ideal. So we have that in mind. We map out someone's spine compared to that ideal, and we try to get them as close as we possibly can. Now, the goal is not to get them perfect, but as close as possible. We use the analogy of blood pressure. 120/80 is normal, right? 125/85, no big deal. 200/100, you better intervene and do something, or that person's gonna suffer really bad health consequences. Same thing with the spine. So when someone has an abnormal neck curve, mid-back curve, low back curve, scoliosis, translation, head shift, all of those things can be addressed by traction, and in most cases, they need to be. So postural corrective exercises we do when someone is limber enough, or at least as a warm-up process prior to getting into traction. What is traction really? Traction is taking someone, they're shifted one direction, we're shifting them the other direction and holding them there for about 15 minutes. Or if you have too little curve in the neck, for example, which is a very common thing we see. Too little curve in the neck, remember you're supposed to have that forward curve. We now load a forward curve into the neck for about 15 minutes, and the goal is to remodel and change the shape of the spine. So how does that really happen? How long does it last? What happens once you stop doing traction? Do you just lose all of those gains? I'm gonna show you. So I have a plastic bag here, and the reason I have this plastic bag is because I wanna demonstrate how traction affects the tissues of the spine. What happens is that when you load the spine from 0 to 10 minutes of time, what's happening is that if your deep muscles and your ligament and your disc is represented by this plastic bag, what happens for the first 10 minutes? It puts a mild stretch on there. It stretches, and if you got out after 10 minutes, you wouldn't be able to really tell a whole lot has happened, meaning that plastic would still be the same shape, the same distance, all of that. As soon as you exceed 10 minutes and you get up into the 10 to 15 minute range, that's where this actual plastic bag and your deep muscle and ligament and disc will go through what's called plastic deformation. And then after we get you out of traction, it stays permanently deformed. Now, it doesn't happen to that large extent. We're talking about fractions of a millimeter or just a millimeter each visit. But what'll happen is that we will gradually change the length of tissues and change the shape of the spine. This will never go back to normal. This will never rebound into that normal plastic bag position. It is forever deformed. That is the same idea with traction. Now, I know the term deformed may sound scary or negative, but that is simply an engineering term, a term that applies to the physical properties of changing a substance. In this case, the substance is deep muscle, ligament, and disc. So now a question is, well, what happens if you do traction, you fix a curve in the spine, and then you just don't do anything? Now, that's not something that we recommend. We highly recommend continuing corrective care at home and some level of corrective care in the clinic as well, as far as getting your spine checked, adjusted, and periodic traction visits may be warranted for your case as well. However, there have been cases that have been seen and studied where patients have gone through phases of corrective care, they disappear for a year or two, they come back into a corrective care facility, then the doctor takes new x-rays, and lo and behold, they still see corrective changes have maintained. Now, sometimes they will back off somewhat, but they've done these studies in 1 year and 2 year follow-up on a very small population size. Keep in mind, this is not something that's been studied with thousands and thousands of people, so unfortunately, there's just not data to report on that. But I've seen patients over the years as well that have come in after they've done corrective care with us, and they still have some of those corrective changes, albeit if they're not doing home care, if they're not doing anything else, they will lose some of that progress. So just like going to the dentist and making sure that you keep your teeth healthy, we're really preaching spinal hygiene, maintenance of the spine. So once you go through corrective care, maintain this with home care, maintain it with follow-up visits periodically in this facility so that we can really take all these amazing changes that you're going through right now and maintain this for a lifetime. So I hope that this brief video helps explain what traction does, how it works, and why it's so important.